Good morning, everyone. As mentioned, I would like to start with a story, and I really appreciate all you being here. The story takes place in a small town in Connecticut where I was raising my family, and it's about two boys who were in high school. The first, Mikey, was diagnosed with cancer. His family certainly was devastated. However, they were easily able to access the highest quality medical care, all based on proven science, research. Mikey's parents told their friends what they were struggling with, and our entire community rallied behind Mikey and his family. Parents came to their home with cooked meals, drove carpools. The kids in our elementary school held bake sales on the weekends. And the whole time Mikey was sick, he received all the love and compassion that anyone with a disease could ever dream of. Well, 2 streets away, my son Brian, Mikey's friend, was also struggling with a disease. But for Brian and our family, it was so different. We looked for medical care for our son, but we couldn't find any that was based on science. Unlike Mikey's parents. I didn't tell any of our friends what we were dealing with. To be honest, I was ashamed, embarrassed as a father. And our community didn't rally behind us, even those who knew about it. No cooked meals, no carpools, no bake sales on the weekends. But when I think back on those years, the worst, when Mikey came home to visit from his treatment, he got the love and adoration. When Brian came home to visit from his treatment, he just got silence and scorn. The disease my son struggled with was addiction, substance use disorder. My son valiantly fought this disease for 8 years. 8 different treatment programs that I now know were not following science-based practices, but I didn't know it at the time. But he tried his hardest, sometimes tough, sometimes smiling away, said, "Dad, I got this." But addiction always doesn't work that way. On October 20th, 2011, I was woken up in the middle of the night by my cell phone ringing, and when I picked it up, I was told that my son had just died. He was 25 years old, and he had not used a substance in 13 months. And equally tragic, it wasn't just addiction that took my son's life. It was the feeling of shame he had every morning when he opened his eyes. Of all day long, whether he was at his job, working, or he was at school taking his courses, or with friends, feeling ashamed all day long, feeling awkward, feeling out of place, with low self-esteem. The history on his computer shows he woke up that morning, researched suicide notes, wrote a note of his own, lit a candle, and took his own life. Alone. Mikey was a patient. His friend Brian was an outcast. It certainly doesn't get any worse as a father. In the weeks that followed, I began to focus on 2 questions. What could I have done differently as a father? What did I miss? And secondly, that would have to be accepted. What could be done to spare other families of the tragedy my family had suffered? Let's make good out of this. So I took what I thought would be 3 months away from my business and traveled the country meeting with experts. I'd learned so much during that 3 months, but when I came back, there was one thing that stood out above everything else. I learned that our federal government had provided grants of about $20 billion to researchers across the country in the couple decades prior, And those researchers had successfully used that funding and created wonderful bodies of knowledge. Knowledge that had proven without any doubt through randomly controlled trials, if our healthcare system and our communities did certain things, 20 to 40% less of our loved ones would use substances and develop this disease. And for those who had developed this disease, if our treatment system followed certain protocols, all based on research, those in treatment would recover significantly better than they were currently recovering from in our treatment system, if you want to call it that. And they would recover at rates on par with anyone being treated for any other chronic illness, like heart disease or diabetes. But what struck me, it was all buried in medical journals and it was not being implemented. As a father, it destroyed me. Are you kidding? But coming from a background in business, I saw an opportunity. It answered my questions. What this nation needed, what our families needed, was one well-funded national organization, like there were for other diseases, to lift this information out of the journals and simply block and tackle and get it implemented. So from this, Shatterproof was formed 10.5 years ago, after a year and a half of business planning, with 3 criteria, guiding criteria. 1, everything that we would do would be based on science, not opinion. Number 2, everything that we would do would only be things that not only help people today, but catalyze partnerships where we can change the entire system. So we would not only be helping people today, we would be helping their children, grandchildren, future generations. And number 3, run this profit like a very efficient for-profit company with metrics and efficiency. As I'm standing here now talking to you, yes, I miss my son all the time, desperately. Really thinking about, even worse, what he felt, the shame. But I also feel blessed in so many respects. I've had such a wonderful opportunity over the last 10 years to meet so many wonderful people all across the country. Hundreds of thousands have joined with us, hundreds of companies, just about every state, the federal government, federal agencies, community-based organizations. And together, we have made unprecedented impact in changing the way that this disease will be prevented, treated, and recovered from in this country. And we're just beginning. Just beginning. One of our initiatives was ensure that everyone with a substance use disorder who's looking for treatment will find treatment that's based on science. That my son wasn't able to, but Mikey's parents were for their disease. So we developed a first-of-a-kind quality measurement system where we gather data from treatment programs, health insurance claims, and patients. And we show on a website free to people looking for treatment which treatment programs are following science-based practices and which ones aren't. And then we take a step further. We license the data to health insurers who are using it to build better networks. If you're not following science-based processes, you're going to be dropped for their networks. And if you are and you're not in their network, you'll be brought in. That's changing the system forever for our grandchildren and great-grandchildren. That's treatment. Another big initiative, shame and stigma. 75% of the public doesn't think this is a disease. 55% of the public think those with this disease have poor character, bad character, actually. Almost 40% of those with this disease feel ashamed of themselves, with low self-esteem, including those who are in recovery and haven't used a substance for a year or longer, as did my son. And then there's healthcare professionals. Healthcare professionals, 65% of healthcare professionals don't think this is a disease. 45% don't think medications are effective, when they are. Corporations. Almost 40% of hiring managers in corporations would be unwilling to hire someone if they knew they had a substance use disorder, including those who are in recovery and haven't used a substance for a year or longer. So we attack this as one of our main pillars. We work with one of the leading strategic consulting companies in the world for a year and a half, all pro bono on their part. We studied 11 social movements, and we looked at all the research, had interviews with experts, and we developed a national strategy to end the stigmas of addiction. Public, self, medications, structural, and developed a plan to do so. Right now, we're implementing the first years of that plan with 3 initiatives. Number 1, we developed a partnership program that we operate with states, in partnership with states and community-based organizations to educate citizens in their state. And I'm thrilled to say, in the states we've been operating it in, we have reduced stigma more than has ever been recorded on the planet Earth in those states, and it's starting to grow, spread across the country. Number 2, we developed content, 4.5 hours of content specific to healthcare professionals to change the way they think about this disease, their patients, and the medications they treat it. The content's been finished, we're just kicking it off. And then the third pillar of our work within stigma is corporations, which we've been working with since the very beginning. Companies such as Hilton, KPMG, JP Morgan Chase, dozens and dozens of others that we have partnered with, helping them to be taking first steps in helping the people, their employees, as well as the public. We're a one-stop shop for these companies and our partnerships, guiding them every step along the way for employee education, corporate culture, community events, and educating the public. For any of you here who could be interested in working with us, can 3 of my colleagues who are here just stand up for a second? All 4 of us will be at lunch. Feel free to walk up to us, and we're also on the app. But we're working with dozens and dozens of companies, and it's growing every year. In closing, another story. It was turned out to be the last time Brian came home for a visit. 4 months before he died. We had a great weekend. And that last night, we were sitting on the back porch talking about his favorite topic, Eli Manning and the New York Giants. And then the topic turned to his recovery. And he looked at me and he said, "Dad, I wish that someday people would realize I'm not a bad person. I'm a good person. And Dad, I am trying my absolute hardest. I have a tough disease and I'm working at it." Well, in the last 10 years, and today in front of all of you, we are changing this. We are granting his wish, and not just his wish, it's way beyond my son. It's the wish of the next son, the next daughter, the next brother, the next sister, the next family member who comes along. That's what we're doing. We are dragging addiction out of the shadows and bringing it back into our hearts. Thank you so very, very much.